Welcome to checkpoint number 6. In the following module, you will learn about Toronto EMS. There will be a small quiz at the end to test your knowledge. Enjoy. As a HWEP exercise program group exercise instructor, it is important to have fun and actively interact with your participants while being aware of their health conditions, the signs and symptoms which you may observe, and how to react accordingly. To increase your awareness of the underlying conditions your participants may have, it is imperative to have each participant fill out a HWEP exercise program participant application. This application includes information regarding their emergency contact information, allergies, current medications, and their health history. Encourage your participants to wear a medical alert bracelet or piece of jewelry if they have a medical condition. This way, in case of emergency, those within their vicinity can react appropriately and in the most efficient way. It is important to note that it is rare to have a medical emergency, but you should always be prepared for the worst case scenario. Remember, these people are already in your class, but now they will be identified. Getting immediate help when a medical issue arises is crucial. Time is muscle and time is brain, meaning that prolonged ischemia due to an injury to the heart or brain can lead to tissue death, which is known as necrosis, if left untreated for too long. Every minute during an acute ischemic stroke, 2 million brain neurons die. Treatment is most effective if started within 4 hours after the onset of symptoms. For a myocardial infarction, treatment is most effective if started within 6 hours of injury. Ultimately, the quicker the treatment, the less likely the individual is to die, and more tissue can be saved, leading to a better quality of life. Unfortunately, patients are likely to receive delay of care. Researchers have stated that the average time people delay seeking medical care from the onset of symptoms is 2 to 6.5 hours. Because of the importance of efficient and effective treatment when a medical emergency is called in, the dispatcher will ask if the nature of the injury is myocardial infarction or stroke, and will prioritize accordingly. Within the GTA, there are several EMS vehicles equipped with 12-lead ECG monitors and advanced care paramedics to assist with a diagnosis. The receiving hospital will be notified of the nature of the injury and will appropriately prepare for the incoming patient. This type of communication speeds up the medical treatment and interventions. During both aerobic and resistance exercise, signs and symptoms of participants should be monitored. During your exercise class, you may observe one of your participants in discomfort. It is important for you to be aware of the signs and symptoms of various conditions. If you observe or have your participant tell you when they are experiencing any of the following, it is important for you to stop exercise and either rest and continue at a lower intensity or get help. Dizziness or feeling faint, palpitations, excessive shortness of breath, angina pain or discomfort, signs or symptoms of hypoglycemia or hyperglycemia. If any of the previously discussed signs or symptoms occur, it is important for the individual to stop exercising and sit down or walk around slowly. Any further stress on their body could lead to a full-blown myocardial infarction or stroke, causing irreversible tissue damage, altering their life forever. It is better to be safe than sorry, and take any precautions necessary to ensure the safety and well-being of all your participants. Due to the nature of the HWEP exercise program classes, it is important for you as well as the participants to be aware of the signs and symptoms of a heart attack. The following are the signs and symptoms you should be looking for during your exercise classes. Chest pain or discomfort, uncomfortable pressure, squeezing, or fullness, indigestion or heartburn, discomfort in one or both arms, back, neck, jaw, upper part of stomach, shortness of breath, nausea, vomiting, lightheadedness, cold sweat, fatigue or lack of energy. If any of these symptoms are observed, it is important to act quickly and get help immediately. As an instructor, you should be aware of the differences between angina and muscle pain, and help educate your participants on the differences as they may confuse the two during the first few exercise sessions. Angina can be described as a heavy squeezing or constricting feeling that typically originates behind the sternum, and can also be felt in the shoulders, arms, neck or jaw, back or upper abdomen. Some participants will have experienced angina, which can be induced by exercise, while others may have never experienced this symptom. If a participant is aware they have angina, They should maintain an intensity of 10 to 15 beats below their ischemic threshold, which is the pulse rate at the onset of angina. Muscular chest pain can be described as a localized pain caused by pressing or stretching of the affected muscles. If the symptoms increase with movements such as bending, twisting, or pushing on the affected area, then the symptom is musculoskeletal. If a new symptom of angina or a change in frequency or intensity of a participant's symptoms occur, the participant should seek medical attention. Once again, it is important for you and your participants to be aware of the signs and symptoms of a stroke. As you may recall from the stroke portion, the signs and symptoms can include weakness, sudden loss of strength or numbness, even if it is temporary, trouble speaking or difficulty understanding a conversation, vision problems, sudden severe headache, sudden loss of balance or dizziness. If any of the following symptoms were to occur, seek medical help immediately, as the faster treatment is administered, the better the prognosis. If you are to observe any of the previously mentioned symptoms in any of your participants, it is important to stop exercise and act accordingly. Whether they are experiencing shortness of breath, stroke, heart attack, or hypoglycemia. If the participant has any medications which may decrease their symptoms, you should help them administer it while continuing to monitor their symptoms. 911 should be called at this time. If the participant is unresponsive, unconscious, you should initiate your facility's emergency plan. This plan will be dependent on what your facility has put in place. Some facilities have their staff blow a whistle 3 times to signal a medical emergency. It is important to get help immediately, so delegate tasks to several participants in your class. Have them notify the front desk to call 911, retrieve an AED if needed, and perform other tasks as needed. If your participant is conscious, keep them comfortable while continuing to monitor their airway, breathing, and circulation until help arrives. All rooms in your facility should have emergency information such as numbers and locations posted. When contacting 911, it is important to tell them the location, the address of your facility, the room you're in, and the best route of entry. Suspected problem, heart attack, stroke, hypoglycemia, etc. Patient information, their gender, age, medical condition they have, and their level of consciousness, as well as medications they are currently taking that you are aware of. Answer any questions the dispatcher may ask you to the best of your ability. It is important to stay on the line as they can assist you with proper patient care until medical help arrives. Delegate a participant to meet emergency personnel and direct them to the ill person. Be sure to let the dispatcher know what the suspected problem is. This way they can send the appropriate level of paramedic. Emphasize the importance of time and getting help as soon as possible. It is important to have a facility emergency plan in place. This will ensure an efficient response to any issues which may arise. In order to ensure immediate emergency care, it is important for you to know the locations of the AEDs in your facility. You should also teach your participants about the AED, where they are located, and how to use it. An AED is a portable device that is used in emergency situations involving cardiac arrhythmias. As a leader, if you were to experience a HWEP participant that collapses, it is crucial to begin CPR and retrieve an AED immediately. Once the AED is attached to the participant, it will analyze the rhythm and perform the necessary actions. If the patient is in a shockable rhythm, an electrical current is administered. This causes a brief moment of asystole, which means the heart has no rhythm, allowing the heart to hopefully restart with a normal conduction. AEDs are made to be used by the general public. There is no required medical or technical knowledge needed to use an AED. The auditory and visual commands are simple and easy to follow. Once the rhythm has been analyzed, the device will then either intervene automatically or will give the rescuer step-by-step instructions on what to do next. While on the line with 911, it is crucial for you to state the nature of the issue, especially if you suspect it being a heart attack. This will ensure they dispatch an advanced care paramedic that is equipped with the proper tools and equipment to assist in cardiac diagnosis. The emergency will then be classified as high priority. The paramedic will speak with a cardiologist on call at one of the 5 coronary catheterization labs in Toronto and the participant will bypass the local hospitals and go directly to the lab. From here, the participant will be rushed into surgery. The quicker the participant receives treatment, the less likely they are to incur permanent myocardial damage. The closest STEMI labs in the area are presented here. You should become familiar with these sites in case of emergency. Similar to heart attacks, stroke is a medical emergency that requires immediate care. The emergency medical treatment for stroke patients depends on the type of stroke, severity, and how long it took the patient to arrive at the hospital. Treatment can include thrombolytic drugs to dissolve the clot or surgery. A pre-hospital redirect protocol was developed to allow patients quicker access to thrombolytic drugs and acute stroke treatment. Like those suffering a heart attack, patients will be transported by advanced care paramedics to one of the 3 regional stroke centers within the GTA, as displayed here. Being a HeartWise group exercise instructor has a lot of responsibility. Although medical emergencies are rare, it is important to have current certifications and training, have a critical information binder, which includes participant health history and health conditions, a nearby AED which is updated, and an emergency action plan if something were to occur. Remember, time is crucial, time is muscle, time is brain. Even if you are not sure, it is best to have called for help and it be a false alarm, than not to have called and it be a serious medical issue. Case study. A 66-year-old male has severe chest pain during your group exercise class. He collapses while doing cardio and is clutching his chest. It is obvious he is in pain. He is pale and he is excessively sweating and is complaining of pain in his back. You take his pulse and you realize that it is too quick to take manually. How do you proceed? Be able to recognize that this is a possible heart attack. Stop exercise. Ask for the rest of the participants to leave orderly and quietly. Help administer any medications. Get someone to call 911 and provide them with the following information: location, best route of entry, suspected problem, medications, and patient information. Stay with the patient until paramedics arrive. Test your knowledge. What is the difference between angina and muscle pain? Angina is the heavy squeezing or constricting in chest, and it can also be felt in shoulders, arms, neck, jaw, or upper abdomen. Muscle pain is localized pain caused by pressing or stretching the affected areas. It increases with movement such as bending, twisting, or pushing of the affected area. Why do you need to fill out a HeartWise participant application? Knowing the patient information will allow you to react in an appropriate and efficient manner. What is the time frame to get to a hospital for heart attack and stroke? For stroke, it is 4 hours. For heart attack, 6 hours. Congratulations, you have finished this module. Please click on the HeartWise symbol to get back on track.